Hello, everyone. This is Tom Fox. I'm the Compliance Evangelist, and I'd like to welcome you to this special 5-part podcast series sponsored by Affiliated Monitors, which celebrates Affiliated Monitors' 15 years in business as the first entity specializing in independent integrity monitoring. Founded in 2004, Affiliated Monitors provides independent integrity monitoring and ethics and compliance assessments nationally and internationally and across almost all industries. With its knowledge of effective ethics and compliance programs and cultures, Affiliated Monitors is respected for its work as the corporate monitor on matters ranging from multinational corporations to small and mid-sized companies and even individuals. Having served in nearly 750 monitorships, no one has more experience as an independent monitor than the team at Affiliated Monitors. For more information on how an independent monitor can help improve your company's ethics and compliance programs, visit this podcast series sponsor, Affiliated Monitors, at www.affiliatedmonitors.com. In this 5-part series, I visit with Jesse Kaplan, the Managing Director of Corporate Oversight at Affiliated Monitors, in a series on emerging issues in healthcare compliance and independent monitoring. We take up the opioid crisis, focusing on prescribing opioids, regulatory and compliance risks, the identifying and mitigating risk around opioid prescribing. We consider the expanded use of an independent monitor in healthcare regulatory situations. Then we take a look at it from the independent integrity monitoring of healthcare organizations and systems. And finally, we conclude with using independent integrity assessments and monitoring to limit adverse consequences of compliance violations. This 5-part series is sponsored by Affiliated Monitors, and it is a special presentation of the Compliance Podcast Network. In this episode, we consider how health regulatory agencies are using independent monitoring to serve important public policy goals, specifically to help ensure a ready supply of quality healthcare providers, particularly for government programs like Medicare and Medicaid. Hello, everyone. Tom Fox back again with Jesse Kaplan, Managing Director of Corporate Oversight at Affiliated Monitors, for episode 3 in our 5-part exploration of emerging issues in healthcare compliance and monitoring. Today, we're going to take up the topic of expanded use of independent monitoring by health regulatory agencies. Jesse, with that incredibly long-winded introduction, first of all, welcome, and thanks for taking the time to come back and visit with me.
Yeah, my pleasure, Tom.
Jesse, in our first couple of episodes, we talked about, or rather in other episodes with your colleagues at Affiliated Monitors, we've talked about how independent monitoring can be effectively and efficiently extend the ability of government regulators to oversee healthcare providers and organizations. Can you explain a little bit more about how independent monitors can serve this purpose for regulators as opposed to other stakeholders in the healthcare debate?
Yeah, absolutely, Tom. So, first I can speak to some extent about the value of monitoring to the government based on my own 20 years or so of experience as a government enforcer with the U.S. Department of Justice and the Massachusetts Attorney General's Office, and also healthcare regulator with the Massachusetts Executive Office of Health and Human Services. As an investigative enforcement and regulating agency, the government's objectives are typically to ensure, above all, that patients and healthcare consumers receive high quality and safe care, that taxpayer money is efficiently and well spent, and that there's a healthcare industry environment and culture of compliance, transparency, and quality. In some cases, there are participants in the healthcare industry that simply cannot and will not meet these standards. And, regulators will and should come down hard, including taking action to exclude the business or the individual provider from the industry in those extreme cases. But in many, if not most cases, what the healthcare company or practitioner really needs when they have an issue is remediation. And if a healthcare company a practitioner can operate in the future in a manner that meets the government's objectives, compliance, transparency, high quality care, that it's good for the industry and good for the for the patients, for those healthcare providers to remain, in the market. So the challenge is that the government doesn't typically have the resources to closely monitor a company or practitioner, ensure that they have remediated their problems, and that they continue to operate at the highest ethical and quality standards. Now, when the government assigns resources to monitor ongoing activities of a company that has had significant compliance problems, that means there are less resources available to investigate new complaints, about other healthcare companies, or to take new enforcement actions where necessary. So without independent integrity monitoring, the government may feel that it really only has one option when there's a bad actor, and that option is to take a very hardline enforcement approach that may mean exclusion from government healthcare programs or revocation of an organization's or a practitioner's healthcare license. Independent monitoring actually provides an alternative. It offers the ability to have an independent and credible firm closely monitor the healthcare company's future and ongoing compliance, thereby protecting the public and the public fisc without having to use government resources to do so.
Jesse, we've talked about some of the benefits, or rather having a robust compliance program, but there's, as you just articulated, there's a regulatory scheme around this. And sometimes a regulator has to come down on a recalcitrant prescriber, or rather healthcare organization, but yet they don't want to put that healthcare organization out of business. They want to work with that healthcare provider. Healthcare resources can be scarce in many communities. And regulators really are not in the business, I don't think, of putting people out of business unless there's significant criminal activity. But if something can be remediated or something can be fixed, how can an independent monitor such as yourself and affiliated monitors really help a healthcare provider or healthcare organization that has stumbled into some incorrect procedures or policies or prescriptions around the opioid issue?
Right. So that's a great question. I mean, it's pretty clear the benefits to the government of having an independent monitor. So what's the benefit to the organization that is going to have an independent monitor maybe imposed on them? So in the first place, it may be their only alternative. The the only alternative may be to have an independent monitor if they don't want to have their license suspended or be excluded from a government program. So to some organizations, they may see independent monitoring as basically a necessary evil. But we think it's more than that. And in our experience, and we've done, well over 500 monitorships, the monitoring engagement can be a real positive and benefit for the organization, particularly healthcare organizations or healthcare practitioners. For example, having an experienced third party assess your compliance with conditions, and in particular, identify where the organization is meeting or exceeding its requirements, as well as the areas where there are gaps in compliance, can be very valuable to the organization. Typically, at least in the matters where we serve as the independent monitor, we will communicate to the organization what they are doing well, what they need to improve on, and communicate that to the organization before we report to the government agency. This will typically give the organization the opportunity to remediate the areas that need remediation before the gaps are reported to the regulator, or if they aren't able to timely remediate the gaps, to be prepared with a plan that they can communicate with the regulator on how they intend to address the deficiency. We like to say that independent monitor serves often as a bridge between the organization and the regulator. And frankly, the independent monitor can help the organization navigate its compliance with the required conditions and have a good working relationship with the regulator.
So, Jesse, I was wondering if you could give us some examples that you're aware of where healthcare regulators are using independent monitors in different contexts within the overall healthcare industry.
Yeah, absolutely. And I'll give you an example that we're involved in. So we are currently engaged in monitoring conditions imposed by a state Department of Health on two hospital systems. They're two separate matters, but involving the same state Department of Health. both these hospital systems encountered significant patient safety issues, and because of those issues, they risked losing their accreditation status and even their Medicare participation, which can be the death knell for a healthcare organization. They ended up entering into consent agreements with the State Department of Health that included a series of remedial measures, including investments on improvements to their safety that they had to make, working with the Joint Commission, implementing what are called targeted solution tools to address their deficiencies. They had to report to their own boards of trustees and quality oversight committees of their problems and of their remediation. And as you know, Tom, I've heard you say often is that compliance starts at the top. So boards of directors and quality oversight committees of the boards have to know what's going on and have to help drive the solutions. So that was all required in these consent agreements with the Department of Health, including reporting their progress to the Department of Health. And in both cases, the Department of Health required the hospital systems to engage an independent monitor to observe, validate, and report on the compliance with all of these conditions. I believe in these instances, both the regulatory agency and the healthcare organizations would attest to the benefits of having the independent firm serve, again, as the bridge between the organization and the Department of Health in facilitating their compliance with all the conditions in the consent agreements and in maintaining productive communications between the regulated entity and the regulator.
So, Jesse, unfortunately, we are near the end of our time today, but I hope you'll join us tomorrow in episode 4, where we take up independent integrity monitoring of healthcare organizations and systems. Jesse, I look forward to continuing the conversation.
Thank you, Tom. My pleasure.
This is Tom Fox. I hope you enjoyed this episode in our 5-part exploration of emerging issues in healthcare compliance and independent monitoring. Also, I hope you will check out our sponsor's website, www.affiliatedmonitors.com. I hope you will join us again for another episode. This 5-part podcast series on emerging issues in healthcare compliance and independent monitoring is a special production of the Compliance Podcast Network.